COVID's changed so many industries, and it's accelerated trends. It's slowed things down. It's completely stopped or stalled a lot of things just in general industry. How has COVID affected some of the trends that have been accelerated, maybe in some cases, and where has it stalled some of the progress in healthcare?
Regulators and physicians and health systems becoming more open to technology would be the first and foremost, specifically technology that expands access. I think Senator Bill Frist, who's on our board and is a very large KOL in the space, came up and said that this has accelerated healthcare innovation by about 7 to 10 years by his judgment. And that's largely what we're seeing play out as COVID and its effects have been fully felt over the last 4.5 months. You're seeing deregulation around providers practicing through telemedicine across state lines. Normally you have to get licensed in every single state. They've essentially said, if you're on Zoom and you're providing care to a patient and it's within standard protocols and practices like it would be in an office, you can practice in another state. There's been a move in reimbursement from CMS, Medicare and Medicaid's essentially like a rate setting body, telling physicians, we're now going to support telemedicine at the rate you would have been paid had you seen the patient in the office. All these go back to your original point you made earlier, Tim, of like, hey, I wish care was a little bit easier and less cumbersome to get. Well, you know what? Physicians are now doing all this from home remotely and are like, this is actually for a lot of things, not everything, but for a lot of things more convenient for everybody involved, including us. We're really supportive of having this stick around in a lot of ways. There are some unintended consequences. A lot of care has been deferred that was not emergent. So elective procedures is what they're called in our industry. The funny thing is not a lot of this is elective. So like, for example, our test, if you don't get it, you have a very high chance of starting to go blind, heading down that path towards blindness. That was considered elective because it wasn't related to like an acute medical condition in the moment. And now everybody on the provider side has these massive backlogs. Everybody still needs this test to be done. Their bodies didn't stop being damaged by diabetes in terms of their vision. Now they got to play catch up, but not only for just your single area you might focus on, but for everything. So there's, I think, going to be further opportunity looking forward over the next 6 months to 24 months to bring more automation in, because people are at a point where on the provider side, they're kind of hurting with the amount of backlog that they have to catch up on, and they're more willing and open to playing with new technology. So in a very, very strange way, in a very small way, that's a little bit of, I guess, a silver lining for most of us that weren't directly impacted by COVID in terms of our health or our family's health, is that we should see more speed of adoption around some of these things, because largely the relaxation on some of this, like telehealth and remote monitoring, has gone off without really to date any significant harm being reported, and people are feeling a little bit more comfortable about continuing at this speed of adoption.